A tracheostomy tube can be life-saving, especially in dogs and cats that have upper airway obstruction and present pretty much almost apneic. So to do a tracheostomy procedure is actually fairly straightforward, and I like to teach it because, again, it can be life-saving. The tools you'll need for a tracheostomy include a blade, sterile scissors, needle drivers and pickups, some heavy aught suture, umbilical tape, and a tracheostomy tube. Now there's commercially made tracheostomy tubes that are really nice for a major reason is because they're the right length, and also instead of having to take the whole tube out to clean it, it has an inner cannula. So you can leave this part of the tube in your patient and just switch out the inner cannula to clean it. If you don't have commercially available tracheostomy tubes, you can make your own in a hurry. All you do is you take a regular endotracheal tube and you cut it down the sides, and you take the end and put it in like so. And you want to make sure when you cut the sides down to shorten the length of the tube that you don't cut the tubing or the canal where the tubing blows up the cuff. And then you can place the tracheostomy tube, put a few holes at the end here so that you can then tie the tube to your patient using umbilical tape. So it's fairly easy to make a homemade tracheostomy tube if you don't have the commercially available ones. So again, it's best to have your patient anesthetized and intubated if possible if they don't have an upper airway obstruction. To find your landmarks, your patient should be in dorsal recumbency, and you palpate the laryngeal area and the front part of the sternum, and you're going to start your skin incision anywhere in between those areas. When you do your skin incision, the biggest thing to remember is just to stay on midline. As long as you stay on midline, you're not going to encounter any major blood vessels and have any problems. Your skin incision can be as big as you need it to be in order to visualize the muscles in the trachea below. So on midline, what you're going to see is a lot of times a natural separation between the two strap muscles, the sternohyoideus and thyroideus. If you don't see the natural separation, sometimes there's a white line in between there, you can take and bluntly dissect in between the two muscle bellies. And again, as long as you stay on midline, you shouldn't have any problems with bleeding. And what you'll find when you separate those two muscle bellies and go through some of the subcu tissue is that your trachea is right there. And again, you don't want to lift up the trachea like this. I'm just doing this so that you can see, how really easy it is to get to the trachea, and how, again, if you stay on midline and just separate those muscles and bluntly dissect, that your trachea is fairly easy to approach. And again, I'm just putting this instrument underneath the trachea so for visualization purposes, so you're not going to be doing this. So the next thing that you're going to want to do is you're going to want to locate where you're going to make your incision into the trachea. And really you can make an incision in between any of the tracheal rings, and you can go about a third of the way through the circumference of a third to half the way the circumference of the trachea. You don't want to go more, obviously, because we want to try not to transect the trachea. The next thing you're going to do is you're going to put stay sutures And I always say that this is the most important part of this procedure because the stay sutures are going to act like handles in case your tracheostomy tube comes out. And if that happens, it's very difficult to place the tube back in without having stay sutures to hold on to. So if I'm going to make my incision through these 2 rings, what I want to do is make a stay suture just cranial and just caudal to where I'm going to make my incision. So you want to incorporate some of the tracheal ring. You don't have to go all the way through a tracheal ring, but you can. It doesn't really matter. And you're going to make this, again, it's going to be heavy aught suture, and it's going to be like a handle. So you want to make a big loop. Like so. And you want to make sure it goes at least around 1 ring or half of a ring. You want to be able to pick up the dog basically with this suture. It's going to again be life-saving. If it pulls out, then it's very problematic. So again, you're going to put 1 cranial and then 1 caudal to where your incision is going to be. So once you've placed your stay sutures, you're then going to take your scalpel blade and you're going to make an incision in between 2 tracheal rings in that membrane. And again, you can make it a good size. Make sure it's not more than halfway. And then you're going to take your tube and you're going to place it into the patient. So a couple of things to remember when you place a tracheostomy tube. First, you never want to blow up the cuff unless the patient is under anesthesia or on a ventilator. And that's because if the inside of the tube gets obstructed with secretions, you want to have the patient be able to breathe around the tube to compensate for that. So if the cuff is inflated, they won't be able to do that. Again, the second thing to remember is the stay sutures, very important. It's almost impossible to put the tube back in if it becomes dislodged if you don't have these stay sutures or these handles in. The other thing is we'll usually label this up and this one down so that if you do have to emergently replace the tube, you know which way to pull them open. The last thing to remember about placing a tracheostomy tube is you never want to suture it to the patient. And that's because it can still become dislodged, and if it's sutured to the patient, you're not going to be able to get it out and replace it. So in order to keep the tube in without suturing, what I recommend is using just umbilical tape. So you take umbilical tape, you put it on the one side, you take the other end, go underneath the dog or cat, go to the other side, then you're going to pull it tight and tie it pretty much in a bow in the back of their neck. And that way, if it becomes dislodged, then you have an easy release and it actually stays in place very well just with that umbilical tape. Then you're just going to suture the skin closed around the tube, and we'll just usually use just a cruciate pattern to close the skin a little bit. Again, you want to make sure you have your stay sutures sticking out so they're very visible. So just close the skin above and below the tracheostomy tube opening. And you're done. And then when you remove the tube, when it's time to remove the tube, you just let the opening granulate in. So you don't suture it. Once the tube comes out, you let the tracheostomy hole granulate in.